Hello, friends. After a long time gap, I'm again here with a very interesting teaching video. I also came to know recently because while doing LBC, I found out lab and it was out of date. But the expiry date, it was already expired. The medium had expired. So that was a bit embarrassing situation. But still, I changed the vial and talked to my lab, and when I start and I saw that it is a local company and it was written that it high risk HPV DNA can be also done on that medium. So I was thinking that how is it possible? Are the mediums same or not? What's the advantage of having the same like that? And then I searched and found certain very, very important and interesting things which I have been telling earlier also, but not able to synchronize with what I was doing. So wanted to make a video on this. That is the medium. What is important? What are the different ways of doing the high risk HPV DNA testing? Plus, the latest now the messenger RNA test has come. So Aptima, which is called Aptima test, and it is better. I have already been discussing a lot about this that high risk HPV DNA test is of no use because lot of research is going on and it requires a cold chain. Plus, the sensitivity is very high and specificity is low. The specificity of Aptima, that is the messenger RNA test, is quite good, better than high-risk HPV DNA testing. So I'll be discussing all these things here. So this is a disclaimer. This is educational use only. Clinical judgment prevails, and there's no endorsement. And this is a not a substitute for information IAFU. That is for information use only. So what I'm going to cover, that is what is the significance of high-risk HPV DNA test, which is better, DNA versus messenger RNA test, the collection medium, one of the most important topic of this video, reading the vial, then gynae is not equal to validated, the medium, which I was telling right now, and what you need to ask from your lab, platform validation, CDSCO license, and PAP fixation, and what is the major criteria. So as just now I was telling that the messenger RNA test is in the market and it is much, much more infection. We all know very well that when we go for the high risk HPV DNA testing, the infection doesn't tell that the patient is going to develop CIN2 or 3. It just says that the patient is harboring the infection, and that we have to consider in the in the terms that what is the age, what is her past history in the terms of that is she having multiple sexual partners or she's taking oral contraceptives since long, or whether she has got the nutritional deficiency. In that context, we need to interpretate the test. So the high risk HPV infection could be latent, it could be new, or it could be transit. And this high-risk HPV DNA testing can result in many unnecessarily colposcopies. I also told you in my last many videos that the research is ongoing. There are more than 200 types of HPV, and the researchers have found that right now 14 high risk are present and more are in the pipeline. So this research will go on. They will be go on adding the testing. They will, after 10 or 15 years, they will say that there's no point in doing the high risk HPV DNA test. You go for this test. And for example, already the messenger RNA test, that is the Aptima, is present in the market. So the messenger RNA test is much more specific because it tells you that it is a transforming infection because it measured E6, E7 messenger RNA. So it is more likely to matter clinically, and it has got the similar sensitivity but better specificity, thereby leading to fewer colposcopies. Now, there are more than 100 types of the platforms on which high-risk HPV DNA tests can be done, but there are 6 or 7 assays which are being recognized by the WHO. Even the labs, they develop own PCR system to test the high-risk HPV DNA system. So I have here told you, I'm telling you basically four, and what we do in the test. So one is the hybrid capture. There's a cobas test, which is done by Roche. There's BD on clarity and Aptima, which is done by Holojet. So the target in these, then I'll be telling you about the target, genotyping, what does the positivity mean, sensitivity, specificity, and the setting. So target is we are in all high-risk HPV DNA is that DNA. In the HC2, they do the signal amplification. In COBAS and video on clarity, this is real-time PCR. In Aptima, it is E6, E7 messenger RNA, which is transcription mediated amplification. So genotyping, it is in HC, hybrid capture, it is a pooled. In COBAS, it is 16 and 18, they are separate, and remaining 12 are pooled. In video on clarity, extended 16, 18, 31, 45, 51, and 52, and remaining are pooled. And in Aptima, all are pooled. A positive means high-risk HPV present. In the case of COBAS, you can go for the triage also. Similarly, in BT on clarity test, plus genotype risk stratification. And in Aptima, this means there is a oncogenetically active infection is present. So sensitivity is equal in almost every test, but the specificity is highest. That is, it will, in the case of Aptima, it is the highest specificity leading to the fewer colposcopies. Now coming to the setting. So what does that setting means? Here it means the test is physically run in the lab, the machine format and the workflow. It tells you about the turnaround throughput and whether it suits a big central lab or a small one. So in the case of hybrid capture, what we are doing is that the samples are processed together in a tray of small wells. The lab waits until it has got enough samples to fill a run and then does them all at once by hand in steps. In other, for example, Cobas, BD Clarity and Aptima, they have got automated machines and they run the tests and there's no intervention by the hands and the tests are available immediately. So Viper or the BD, they have got the automated instrument, that is they run the on clarity assay. Panther, it has got the Hologix automated instrument and it runs the Aptima test. So Cobas, it has got the Roche automated instrument and run the Cobas HPV test. So that is the way we have to understand the things. So now coming to that, why the medium matters. I told you I got that vial, easy prep, and it was of expiry. So in the cytology, when we are doing the cytology, the preservation of the cell is very important. It has to be done immediately. Whether you do it with the cytospray, which is not a very good method in the while doing it in your clinic, that is jars with 95% ethyl alcohol is better. We will be telling you again in coming slides. So in those, the cell preservation matters a lot. But in the case of DNA or RNA, that is high-risk HPV DNA or RNA testing, a fixative that cross-links or fragments DNA can sabotage the HPV PCR. And definitely earlier also, I have told you that is why I don't like high-risk HPV DNA testing, because it is not available in the interiors of our country and it is a costly test and it temperature has to be maintained across while transport also and in the lab also. Then the HPV platform must be validated on that exact fluid or the result strip. That is very important. That's what we are going to discuss today. So what is the test? So why the medium is important? So BD SurePath is basically for which is the ethanol based, which is basically for the cell preservation for the pap smear. And thin prep, that is basically a methanol based. It is not the ethanol or methanol, but it is basically the formaldehyde. If a medium contains the formaldehyde, that will cross-link with the DNA, or it will fragment the DNA of HPV. And as I told you just now in the previous slide, that the results will differ. So that is why we have to choose a medium in which the formaldehyde is not present for the high-risk HPV DNA or messenger RNA testing. Formaldehyde might be present for the pap smear or the LBC. That is okay with that, because that copes up with the mucus and blood, and there are fewer unsatisfactory pap smear or the LBC. But when it is present, as I just now told, it cross-links with the DNA, and hence we are not going to get the proper result. In fact, this thin prep where no formaldehyde is present, we get the more residual volume for add-on tests. For example, suppose we want to go for the chlamydia test, or we go other infections or tuberculosis test, then it will be left for that, because we all know that even for the chlamydia and tuberculosis test and other samples, the presence of the formalin interferes with the detection of the test. Now, another important thing which I recognize, that most of the gynecologists, because while giving my colposcopy training program, I noticed that many of us, I also came to know when I started giving the colposcopy training program, that there are certain symbols present on the LBC vial. We are not aware what are these symbols. So this is the sign of the thermometer. It has to be temperature of LBC medium has to be maintained at 15 to 30 degrees centigrade, store at the room temperature. This is open book like. This means consult the instruction for use, IFU. And then this is a cross one, two crossed out. This means do not reuse. This is for the single patient. Then this is IVD. There's a written IVD, in vitro diagnostic, that is lab use on a specimen, not in the body. Then there is a flame with the circle plus warning that it is a flammable liquid, alcohol fixative. We will be talking about H and P codes. Most of us are not very well. What does the H stands and what does the P code, which I'm going to tell you just now. And then this is a sign. This is a factory. EC or RAP means who is the manufacturer, whether it is European Union authorized representative or it is a local made. So just now I was telling you that there are different hazard codes written on it. We need not remember all the things, but at least we should know that the H means hazard, P means precaution, and different plus codes are combined statements. In short, keep away from the flame. For example, H226 means hazard, flammable liquid and vapor. P means precaution. You have to take the precaution. Water protective gloves and eye protection is needed. When P303 plus P361 plus P353 precaution. If on skin or hair, remove contaminated clothing, rinse with the water. So this is just to let you know that we should be well aware of the signs and what are the hazard and the precautions we need to take. So this is very important, because as I gave you the context of my vial. In my vial, this was old European Union sign, that is pre-2015. This is an orange square with the flammable. This is a flame. So black symbol on orange square means only used that the company was using the old R and S phrases, and it has this has to be phased out after June 2015. So what does it mean that the company is still using the old signature? Means that the company is not in line with the latest techniques and latest technique plus the latest what the signs and signatures are being used, that has to be used latest. So it is still adhering to the older protocols, so the medium might not be very, very good. So this is a current red diamond with the red inflammable, red bordered white diamond UN system used worldwide, pairs with H&V codes plus signal words, danger and warning. What does it mean that a vial still using that is a local LBC media signals older regulatory housekeeping, a quite quality telltale alongside expiry and validation gaps. So BD SurePath by contrast shows a current red diamond. So that is the way the quality matters. As I told you just now, that the easy prep solution which I was using was also, it was also written on that it can be used for the high risk HPV. So what I mean to tell you here is that what is the authenticity versus validity? Genine is not validated. Why? Because they are using the older protocols and they are not keeping in line with the quality assurance. It carries an IVD mark, and for HPV DNA line also, the IVD mark certifies intended use and manufacturing and nothing more. So we should be asking our lab whether they have got their own PCR, they are running their own PCR tests, and whether they have validated this medium for the PCR test. Why it is not validated for HPV? Because validated needs performance data. This assay detects CIN2 actually in this medium. This is very important for all of you to understand. The validated needs performance data. This assay detects CIN2 accurately in this medium. This means validation. To trust an HPV result, someone must have run a proper study showing that when the sample sits in this specific fluid, the test still correctly finds a woman with real precancerous, that is CIN2 plus. So validation is equal to evidence, not a label claim. A benign cytology medium can have zero data that your PCR works on it. The vial can be 100% real, legitimately manufactured cytology product and still have nobody who has ever tested whether your lab's particular HPV PCR performs in it. So benign is not equal to tested with your assay. For HPV DNA also, it is a marketing gimmick. It's not a comparator study. So what does that mean? Printing that line on the label is an advertising claim. It is not same as a published head-to-head study comparing the medium against a known good reference. In one sentence, real product plus nice label claim doesn't prove that it will give the correct HPV answer to us. So when you get such local mediums, we should ask our lab or the doctor or the pathologist that which HPV assay they are running, COBAS, video on clarity, Aptima, hybrid capture, or they are having their in-house PCR. And we can't judge a result without knowing that. And on if they are having their in-house PCR, whether they have ran the test on this particular medium. So validation data on this medium is very, very important. Concordance versus a validated comparator means agreement. Okay, you run the same sample on the new test and on a test already proven to work. That is a comparator, for example, hybrid capture or COBAS, and that is why we use a measure criteria. If they agree, high percentage of the time the new one is behaving. If they are saying low concordance, that is a warning sign. And what is the limit of detection? The smallest amount of the virus the test can reliably pick up. A poor LOD means low level, that is early infection slip through as false negatives. You want proof, it detects down to clinically meaningful level. So, very important that we should know all these things. Then whether it is CDSCO, IVD license for HPV use or not. So mostly, if you check, it won't be there. So confirm the medium for the by the CDSCO IVD license. And for example, in my case, I had expiry date. So one should not be using the medium of the expiry date at all. Why it matters to the patient and to us? For the patient, a false negative on an unvalidated medium can hide CIN2 for years. And because screening interval is 3 to 5 years. Overcalling means avoidable colposcopy, anxiety, and the cost. An expired vial may not preserve cells or DNA at all. The sample is wasted, and so is a visit also. And for the gynecologist, because our management hinges on the HPV status, we are dependent upon the laboratory test. And if we get the wrong test, we will give the wrong diagnosis plus the management. Knowing the platform plus validation lets you wear negative correctly, especially in symptomatic women. Documenting that you asked is a medical legal protection and good clinical governance. So the measures criteria, as I was telling you just now, that through this is the criteria used for comparing the results. Okay, this is very important. For it is a shortcut to prove a new HPV test is trustworthy. Compare it to a test we already know that it works. For example, HC2 or GP5 plus 6. Every number is relative to that comparator. So if it should have more than 90% sensitivity, more than 98% specificity, and reproducibility. Low CI. Same sample run twice gives the same answer within and between labs, consistent, and it is not blurred. Now coming to the fixation specification, I have already told in previous slides that when we are doing the conventional PAP, traditional wet fixation is the gold standard. We need a Coplin jar for this and 95% ethyl alcohol, and it should be immediately put inside. Even if you are doing the spray, it should be spray should be done immediately. Otherwise, the cells will be get destroyed. But still, 95% ethyl alcohol in the Coplin jar is the best fixative for the pap smear. So the spray contains alcohol plus carbovex, that is PEG. It is a portable, field friendly. Carbovex must be washed off before staining. It is convenient for the camps, and we need to spray from at least 30 centimeter. Immediately spray is to be done, and after that let it dry. So in clinics, personal patients, ethanol immersion gives the cleaner results. Spray wins on the convenience. So in India, what platforms we have and who is testing regulation? There's no FDA. So IVD falls under CDSCO and the medical rules device of 2017, NABL, ISO, EQA plus WHO pre-qualification. So medias we available is that the local media definitely, but the quality media is the hologic thin prep, methanol, BD short prep plus on clarity, Roche, Cobas Media, Cafet Expert, domestic brands. I have already told you. So who is running what? Metropolis is running the Cobas, Roche tie-up self-sampling, SRL, Dr. Lal, Path Labs, Apollo, SCG, Newberg, Core. All these are the platforms which are running many tests. Many use in-house PCR and we need to ask them. The basic thing is if you're using the local media, then we need to see whether it is meant for the high-risk HPV DNA and it is formaldehyde free. So these are the glossary of the terms. CLP. CLP is setting, I have already told you, and the CLP is the classification, labeling and packaging. Full name Regulation EC 1272/2008. NABL EQA is the external quality assessment. Concordance, how often a new test agrees with a validated comparator when both run the same samples. So you can go through them. I have already told you all these explained in the previous slides. So the basic takeaway is that messenger RNA is a better test and better available. Prices is definitely high. And when we are going for the high-risk HPV DNA, we should see that it should be formaldehyde free. And if there's an in-house PCR, lab is doing in-house PCR, after we should know whether they have validated the medium on which we are sending the sample, because LBC medium is different, PCR medium is different, and which platform they are doing the test, that is the high-risk HPV DNA test. And always, if the LBC medium might not be meant for the high-risk HPV DNA, gynae is not validated, and homebrew PCR, this should be compared to the major criteria. Thank you.